Okay. Oh. Hello. Hello. You wanted to be in the video. Are you gonna climb up? You wanna climb up on the chair? Oh, jeez. He got fat. He's 85 pounds now. Yes, you are. You got tummy. Yeah. Hi, Bubba. Hello. You being a smoochy smoocher. Okay. Hey guys, so I apologize, this video is definitely gonna go up late. It's like 2 p.m. and it's supposed to be up by 3. Don't think that's gonna happen. But today's video is gonna be on a procedure that I have had a lot of experience with, and it is anal dilation or rectal dilation. I'm definitely not making that the title of this video though, because I get a lot of really weird people anytime I talk about enemas or dilations or any of that. So I'll probably just title it like Dilation Surgery, but hopefully this finds the right people. So anal or rectal dilation, dilatation, however you want to say it, is a procedure that's done to expand a stricture or an obstructed area of the intestine. Usually it's towards the end, like end of the colon, rectum, anal area. So that is something that they can do, you know, without having to cut you open per se. So it's more of a procedure than it is a surgery. Basically the way it works is they will take a device, sort of, I don't know how to describe it, kind of like a rod. I have a way of describing it, but I don't want to say it. So they basically take this device that's shaped like a rod, there's different sizes, and they'll start with the smallest size so they can stretch out whatever stricture you have. So they'll increase the size of the device and, you know, kind of go up in size as they're trying to increase the size of the stricture. They want you to be able to pass food and all the stool through, so they want to get an adequate size. More often than not, people will go home after this procedure with these exact devices and be told to do it at home to maintain the stricture, because they will close up. They'll go back to the size that they were. It can be pretty difficult to do at home because it's painful and it really isn't that fun. But usually after the procedure, they send you home on some kind of prescription pain medication to help you get through the first few days. You know, it's painful after they stretch it out and then they're telling you to do it at home without any anesthesia. You know, do it yourself, good luck. So they will give pain medication. Now I'll give you my little backstory about how I started having this procedure. I've had it a number of times, enough that I lost count. I think I'm up in like the 20s with this procedure. They were just doing it every few months for me. But basically what happened was, before my freshman year of high school, I was getting very bloated, unable to eat, having just a lot of trouble. In fact, I go into like a lot greater detail with this story in my struggles of eating video. But basically, I wasn't able to eat anything. I had a GI doctor that thought I was suffering from anorexia nervosa, wanted me to see a psychiatrist, thought that I didn't want to eat and I didn't want to grow, that I had like body image issues, that I thought I was too fat, apparently, which is not at all what was going on. I kept explaining what was going on to everybody. Like I said, I'm not hungry, I'm not going to the bathroom adequately, at least, and I just feel so bloated. Like my stomach is hard, and I don't know how nobody picked up on it, but I was becoming severely constipated because I had this awful stricture right at the very end of my rectum, so low that I can feel it. Like if I stick an enema tip up there, I can't fit it through. Because it's so close to the end. Another symptom that I was having that I explained to my GI doctor, which didn't make sense to me at the time, but now as a GI nurse, I've seen it a few times, and it makes more sense to me. I was having leakage come out. Basically, you would think if you're having this loose leakage that your having diarrhea rather than constipation, but what happens is the stool gets stuck at the end, and anything that's like loose or watery will go around it and leak out without you having any control over it. And I've seen that on a number of kids with like severe constipation. They will have this leakage. So I was having that, and I kept telling people, like, I don't know what this is, like I can't control it, it just leaks out of me. And I was so upset. I was a teenage girl. I was like, this sucks, like I don't know what's happening. I wound up wearing pads all the time because I was so embarrassed, and I didn't want that happening to me. Like, that was awful. That was my worst symptom, and I was so annoyed. And I got to a point where I was like so upset, and I think this was the point. I was having this leakage. I came down one morning and I was like, Dad, I can't take this anymore. I don't know what this is. Like, we need to go see my GI. And I think that was the day that she thought I was anorexic. What wound up happening a week later, I remember it was after homecoming, because I have a picture of me in my homecoming dress, and I look like a few months pregnant in it. Right after this homecoming dance, I started getting really awful contraction-like pain. I mean, it was like pain, 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 and then it would release and I'd be fine. And then pain, 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 and release and I'd be fine. I started having this pain, and I couldn't eat anything. I started throwing up. So we called my GI, and they basically said, go to CHOPS ER. So we did. They wound up giving me pain medication, and I think they started me on fluids or whatever. I think I was getting a little dehydrated just because I couldn't take anything in. But they wound up giving me pain medication. And this was like, I wish they hadn't, although at the time I was like, please help me. I'm in so much pain. They gave me this, and then they decided to do their exam of me. And I remember it was one of the nurses. She had to stick her finger up my you-know-what to see if there was anything going on. I think she was checking for stool at the end, but I couldn't feel any of it. I didn't even feel her finger up there. Like, I didn't even know she was doing it. I was totally fine with it. So I was in the hospital for 2 weeks. They were trying to get me to go to the bathroom because they finally realized, okay, she has a significant amount of stool burden. Trying to get me to go to the bathroom with all the different drugs like Miralax and laxatives and all that, but you know, they were just adding on top. I think they tried one enema. It was not successful. So, sorry, Bruno's right here. And that was when I met my surgeon, Dr. Matei. He walked into my hospital room, and it was literally the first time I was meeting him, and he said, hey, you know, explain who he was and what he was there for. He said, I think I know what's wrong, but I have to do a quick exam of your bottom to make sure I'm right. And within 5 minutes, he had figured out that I had a severe stricture. He did the same exam that nurse had done. He stuck his finger up there, and I screamed out in pain this time because I wasn't on pain medication. I could feel everything he was doing, and he couldn't even get like the tip of his finger up there. And I screamed, and he said, okay, I know what this is. I'm going to get you in, scheduled for the OR. We're gonna dilate this stricture and we'll see what happens. So I got in that afternoon. Like, they got me right in. They dilated the stricture, and by the time I got back to my hospital room, I was calling room service. I was like, please, like, get my diet going. I'm starving, because I was finally able to use the bathroom. And I'm not trying to gross y'all out, but just say I cleared it all out. And I was like, oh my god. Wow, probably lost a lot of weight. But it was such a relief. And we finally, I mean, it was like, that changed my whole life. I was so much better. I couldn't believe it, how much better I felt. So this stricture continued to give me problems. I was unable to dilate it at home because of how quickly it would shrink back up. So what we wound up doing was every 3 to 4 months, I would kind of start feeling the symptoms of getting backed up and all of that. And I would call chop and let them know, you know, my symptoms are increasing, and they would schedule me again, and I would get the dilation surgery. So I got that done from the beginning of my freshman year of high school to, I think my last dilation was my sophomore year of college, to give you an idea of how that went. And my last dilation, he worked really hard on it. he really dilated it. He was pretty rough because I was in a lot of pain. That was the most pain I had been in after the procedure. But it worked, and I haven't gotten a dilation since. Now my stricture is extremely tiny. I cannot fit anything bigger than a feeding tube, basically. But I can still do enemas. I just get it to the end of the stricture and I push the water through, because the water will go through, but the tip of the enema won't. But it has remained at the size that it's been at for 4 years now, and I'm able to pass all the mucus that I need to get out. It's able to come out easily. I don't have any more issues with my colon. Even after I had the ostomy done, my colon would blow up with mucus, so I knew I still had to keep getting those dilations done. But so that's basically the story of how I got all of my dilations done. After the first one, I think all of them were outpatient. I would just go in for the day and get it done and go home. So it wasn't too bad, and often they would try and coincide it with my colonoscopy, like they would stretch the stricture out so they could pass the camera through. So it worked out really well. But let me know if anybody else has gotten dilation surgeries before, because I don't know a lot of Crohn's people that get them done. I've seen probably 2 patients at the hospital who have done them before. But yeah, I was so glad Dr. Matei found that stricture and figured out my main problem. And it just made life so much better. Alright guys, I apologize that this is coming up late. As soon as I get this edited and uploaded, I'll just, you know, it'll be live so you guys can see it. And thank you for all of the comments again, and the support of saying, yay, you're actually uploading frequently. I know. I'm for so long during college, nursing school, all of that, I just did not have the ability to do this, or like the mental capacity to do this. But now I'm able to. Life is just a little more calm than it had been. Knock on wood, right? We never know when a surprise is going to pop up on us. But I'm glad I'm able to upload as well, because this is a lot of fun. Let me know what you would like to see. Tomorrow I have off. I work tonight for 4 hours, but tomorrow I have off. So I plan on working on a few videos. Yeah, so if you comment tonight, just let me know, and I will try my best to work on something for you. And then this weekend I actually have off, yay! But we have a lot of plans. We're going to do some fun stuff, go to Baltimore for Zach's uncle's birthday, and Sunday, I have to do my taxes. But Sunday I'll do that, and church and grocery shopping, and it's just, Sunday's always busy. Sunday is never relaxing, but oh well. Alrighty guys, I will see you soon. Bye. And now Nanners is up here. Oh, hello Nan. Hello. Okay. Okay. Look at the camera. Hello. Is this ever getting done? Why are you guys being so lovable? Huh? Why are you being so lovable? Why? Why?